to be flexible. We should learn to share our time with them adequately so that they are not seeing that new baby as an intruder. One I wanted to really sit on today is coping with the birth of a new baby. Coping with the changing family dynamics when a new baby arrives. Guys, childbearing is one of the most difficult phases everybody that is willing to have children is going to face. It is not easy. We also see the glamour online. Having a baby is not wearing Gucci and Fendi on their little feet, and honestly, it goes way beyond that. There is a whole lot of struggle that people really don't talk about. I feel we don't talk about it enough. We don't talk about the struggles new mothers go through. We don't talk about even existing mothers. See, every child is different. Every pregnancy is unique. Honestly, I've met people that did not have problems with their first, second, third. It's their fifth pregnancy that is giving them so much issue. There are a lot of women that have had no vaginal delivery for like 5 children, and they're having their 6th child, and they're telling them, oh, it's going to be a cesarean, and we can, I'm a shock. So as a new family, you have to prepare emotionally. You have to prepare every financially. My ego people call it. You have to prepare for a baby physically and mentally. I feel like for the men, it is more of a physical and financial commitment. Yes, for our men, it's more of that for them. Even though I feel like we are shifting too much from other things, men should also be emotionally involved. Men should also be psychologically, they should also be involved in the care and the preparation for the birth of a new baby. So what are the things we can do? There is one midwife I follow on Instagram. I love her so much. I don't know. I don't know if it's okay to mention her name here. I'll reach out to her if it's something I can spill. She does these childbirth classes that people can attend. I really love it so much. I see men go there, learn how to wear diapers. I see men go there, learn how to change, how to make feed for their baby, how to assist their wife with extraction of breast milk, preservation. Oh my guys, I love it so much. Sometimes I always catch a baby fever, but immediately I use an antipyretic to shake it off. Then you need to read books. There's this book our mothers used to read that time. I'm trying to remember the name. It's a childbirth book. I've forgotten the name of this book. But if you know the name, I know some of you will know this book. This book that talks about caring for a child, pregnancy, toddler stage, infant stage, adulthood. It is there. Then aside the books, there are a lot of apps right now that you can use to track the development of your child. You can talk to your obstetrician, you can talk to your gynecologist. They can assist, especially if you're having there's what we call special babies. If you're having a special baby, yes, this is babies that belong to women that either had stillbirth, several miscarriages, we call these babies special babies because extra care has to be taken in the care of the mother of these babies. Then you have to discuss your plans with your husband, with your family. If you are going to be needing assistance with your baby, you need to discuss all of this even before the baby comes. If you want your mother to stay with you for a few months, if you don't have a mom, you want a friend or someone to be with you for a few months while you are transitioning from whatever number you had to another number, you need to communicate with them, you need to discuss with them, you need to reach an agreement, you need to decide for your labor and delivery. What do I want to do? Do I want to have an elective CS? Do I want to have a vaginal delivery? Do I want to have an epidural? These things really prepare us in advance. And one thing I always tell new moms is, the way you had your baby is not the important part of this conversation. Whether it is a vaginal birth or a cesarean section or a assisted delivery, vacuum, whatever way you have your baby, the important part of this conversation is you are healthy and your baby is healthy. That is the most important way. And as much as possible, I try to encourage new moms that speak with me. Be open. Be open to anything. Be open to, okay, you've always had a vaginal thing, but be open. When you go into labor and your obstetrician or your consultant or your midwife tells you, guy, this is not going well, we need to take an alternative route. Be ready mentally to switch, to do anything for your baby. Guys, it hurts me so much when I hear of women that died during labor due to avoidable circumstances, especially the ones that involved I was waiting for my husband to come and smell, and my husband did not agree, my mother-in-law said, my sister said. Oh, these ones, they always pierce one part of my chest that honestly I don't want to go into that one really today. That one is a conversation for another day. Keep the line of communication open. Talk to your midwife. Let them understand your fears. Let them understand what is happening with you. See, when moms come to where I work, as much as they are coming for healthcare, I try to look for signs of worry, anxiety. Are you okay? Do you want to talk about something? Do you want to tell me something? Okay. I try to just poke a little, because I know that a lot of us have questions that we are afraid to ask, because we don't want our care providers to get angry. We don't want them to feel bad. We don't want them to feel like, what's wrong with you? Are you the first person that's having a child? I'll tell you one truth. A lot of nurses, midwives, consultants, OB-GYNs, they really want to help you. But the only way they can help you is if you talk. Then you have to create a strong support system. For me, I would prefer you have a very good support system, someone that has been there before. As a single lady that has not had any child, you need somebody that has worked in that lane before, if you have not. To, someone that can be like, oh, okay. I feel like mothers feel better when they discuss with someone in the same shoes with them. Okay, for example, I remember when one of my friends reached out to me and she was like, she had a baby, and she didn't tell anybody she had a baby for like a month or two. But I was aware when she was pregnant. She reached out to me and she told me she was pregnant and all of that. But one day I just woke up and said, this person, he's supposed to reach you. I was trying to be careful that, probably, I was thinking of all the unthinkable that, okay, maybe something happened, that's why she didn't reach out to me. And I took the responsibility to reach out. I was like, babe, how are you? That was the first thing I said. I didn't mention anything about the baby because I didn't want to trigger any previous emotions or anything. I was like, I'm fine. I had my baby okay. Alhamdulillah, you had your baby is fine. So what happened? What's been happening? You've been so good. I was like, it was a CS she did. That's why she's feeling like she shouldn't tell anybody. She's feeling so bad. She's feeling unhappy. She does not feel like a mother. That was what she said. I don't feel like a mother. And I'm like, you don't, why? Because of a cesarean section? You had a baby, your baby is healthy, you are breastfeeding your baby, you carried your baby. See, a mother is a mother. Whether you lost your baby at 1 month pregnancy or you carry the baby till full thing, you are a mother. And that was the first thing I told her. I said, you are a mother, an amazing mother. You went through pain. See, guys, you people think cesarean section is easy. The recovery, shaggy. The recovery is a really crazy process. Honestly, it's a really crazy. So even if you are saying vaginal delivery, I had a episiotomy, I had this is not me invalidating or making anyone feel like the easy route. None of them is an easy route. Vaginal delivery, cesarean section, none of them is an easy route to childbirth. Childbirth still remains one of the most sacred commitments a woman can make, and we should always make it as such. Honestly, that is just the truth. Then you should create a birth plan. Yes, I know a lot of us don't do this thing. Create a birth plan. Okay, I want, especially for those of us that decided the way we want to have our baby. Create a birth plan. Create a route for adversities. I'm glad they say it's an alternative. If this does not go this way, this side is going to go. This is this is my birth partner. It's not compulsory. Your husband is your, what they call it, is it birth partner? I don't know what they call this thing. Your birth partner, yes, I think it's called. It's not compulsory. Your husband, it can be your mom, it can be your sister, it can be your mother-in-law, it can be your best friend, it can be anybody. So you need to know. Then pack your hospital bag, all your essentials for your hospital stay. See, there's one thing I love about some of the women I've been encountering lately. Is the way they are like, immediately after delivery, they are already picking their lipstick and putting it. They're already looking chic. They're already looking pink. I'm like, boy, yeah, that is it. Everything you need to be comfortable in the hospital, please pack it in your bag. Your makeup product is essential too, my dear. Pack it, your snacks, everything you need, pack it. Then practical preparations. This one is the one you do at home. Your baby nursery, your baby. It is not advisable for you to sleep on the same bed with your newborn baby. Please, I always tell mothers this: get a cot. Please, at least for the first few months of life. Please, it is. We'll talk about this on another day, but please, it is not advisable. Then you have to be emotionally ready. See, childbirth can be physically and emotionally intense. Honestly, especially for those people that have babies at home previously, it's a craze. While you are here having a new baby, you're thinking about the one at home. Is he eating? Is he crying? Does he miss his mommy? Does he want to say his mommy? Does she want to say her mommy? You know? And all of this, then postpartum labor and delivery, sorry. This one, okay, I already mentioned have a birth plan, be informed, read about the stages of labor, read about the things that happen. These things are on YouTube. Watch a video of cesarean sections. Enjoy it. How would I say, boxing? In fact, be a part of the process so that when something is going wrong during your delivery, even you yourself, you already know. I already say, please, is there an alternative? What can I do? You have to be involved in your own care. Please, fathers and mothers, now two of them get the belly, now two of them must run out. Then postpartum support, please. One thing I always tell my people is when someone is willing to help you, when someone is extending a hand of care to you, accept it. They don't give awards for the most hardworking women. I see women come back from delivery rooms. 2 days later, they're already drawing up the well. They're already going to the market. They want to cook. For what? Why? Why? Accept help from people. If your mother-in-law wants to assist you, accept it. If your friends want to help you, accept it, please. Then be aware of postpartum emotional changes. A lot of things happen postpartum, you know, the way your body comes out, maybe after delivery and everything, you know, saggy skin, stretch marks on the belly. A lot of women go crazy when they say these things. Please, you need to know it is normal. Stretch marks is genetics. It is genetics. If you have it, you will have it. Although there are a lot of preventive measures that you can put in place, but if it did not work for you, please don't feel bad about it. Your baby brought them. And one thing people don't tell you is that time heals a lot of things. When you give yourself time to heal, these things actually really fade off along the line. Your dark neck, your black belly, swollen foot, whatever it is that is happening after your childbirth, guys, this one is for men. Please, my guys, hey Joe, big go no. Support your wives. This is not time to start pointing out that, babe, see how your neck is black. This is time to say, your stretch mark that was 1 is now 2, is now 3. Please don't do that to our women. This is time to encourage them. This is time to make them feel beautiful in whatever way that they have. And if it is possible, please take a paternity leave, even if it's 1 week or 2 weeks. Even if it's 2 days, please take a paternity leave and be involved in your baby's care. Assist your woman. Let her know that she has given you a precious gift that you really appreciate, guys. Hey Joe. Then self-care, women. After delivery, one truth people don't tell is your stomach will not snatch back the next day after delivery. Congratulations to those that their stomach snatched back after 1 week of delivery. It takes months. Some people, it takes years for your body to return to its pre-pregnancy state. Give yourself time. Take care of yourself. Take your baths, brush your teeth, use deodorant, smell nice, dress well, wear your wig, tie your scarf, be as stylish as you can. I know it's easy, but I'm just still saying it. As much as you can do a lot of self-care. Eat well. All those hot pepper soup that our mothers used to make when we have new babies. Eat it. Eat your food. Rest well. Sleep well. Sleep when your baby is sleeping. And ask for help when you need help. Please. And if this help is not forthcoming, please reach out to your healthcare provider. When you go back, don't wait until your 6 weeks appointment to reach out to your healthcare provider. If you are discharged from the hospital and 1 week later you are not feeling good, you are not feeling okay mentally, you are not feeling okay physically, you feel like, I thought my blood should have changed color by now and it has not, you are still bleeding heavily. Afira, back to the hospital to see your healthcare provider. Lucky are those of you that your healthcare providers are online and can reach out to you, can call you. Congratulations, guys. Then let's now move into another one. Maintaining intimacy during and after pregnancy. During